Hello, this is Antidius T Mbehikya, a laboratory medicine scientist from Tanzania. Our profession may not be known to many because we work behind the scenes. We are like detectives in this healthcare world, since we look for clues that shed light on the diagnosis and treatment of diseases. I'm here to respond to the call by the IFCC, the International Federation of Clinical Chemistry and Laboratory Medicine, for the 2026 MedLab Week annual celebration to tell the world the pivotal role of laboratory medicine professionals in patients' healthcare. This is my story. This is the story of one of my days at the lab. The story that has put back the smile on a patient's face. The story that has inspired me to do what I do as a professional in impacting lives. When I was in my internship at the public regional referral hospital, I received a patient in a phlebotomy room. The patient was about 60 years old male who had a wound on his leg. Looking at the doctor's orders, he was supposed to do a blood sugar test. I performed the test and the numbers were normal. The patient looked uncomfortable. He seemed to be in pain. He seemed to have given up on his wound. So I talked to him. After the talk, I realized that he had been struggling with the wound for over 6 months, over which he had been using antibiotics, dressing the wound, but still there was no improvement. No wonder the doctor wanted to see his blood sugar status to rule out diabetes, which may be the cause for the wound not healing properly. Looking at the wound that was infected, it got into my mind that there may be a resistant strain of bacteria that has not been responding to several antibiotics the patient has been using. So I introduced to him the catch and sensitivity test, which he didn't know, which he had not heard of before. I told him that it's through the catch and sensitivity test we get to isolate the exact bacteria that is causing the infection, and we go further to find out the suitable antibiotic to kill the bacteria and eradicate the infection for good. He responded positively, was ready for the test even at that moment. We consulted the doctor about this, and the doctor gave the green light, so we proceeded with the testing. I collected the sample myself. I did the culture. The culture was positive. I proceeded with the drug sensitivity testing, and finally I came out with the suitable antibiotic for his infection. He started the antibiotics. 7 days later, I received a feedback from him that his wound was recovering. A week after, he visited me. This time, he had a smile on his face. Guess what? He came to thank me. He even brought a gift to me. He was amazed with how the lab testing helped to eradicate the infection that has been disturbing him for over 6 months. Just within a week, and the infection was gone. This is how laboratory tests can save lives. It is unfortunate that when people visit the lab, they end up in the phlebotomy room. They don't get to see the main laboratory, which is restricted to only laboratory professionals. That is the room where highly automated machines, precise machines, and technologically advanced machines are used to perform complex tests on biological specimen for quick and accurate results. These tests are crucial for up to 70% of medical decisions regarding diagnostics, treatment, and patient care. We are in the era where we practice evidence-based medicine, and the laboratory is the backbone for the evidence-based medicine. No more blind treatment. Labs save lives.